Welcome to another podcast in our series, Creating a Caregiver Toolbox. I am Paula Pagan, a licensed clinical social worker and owner of Long Island Elder Care. I take a very proactive approach to treatment, and I want my clients to educate themselves about the services that are available to them. We always want to prevent emergency-driven planning. We need support and coping tools to move forward in our lives. We are here to help. So we appreciate so much Frank Melia. He works for Contour Mortgage for giving us the opportunity for these podcasts in their beautiful studio in Garden City. Today, I want to welcome Danielle Barberi, social worker and senior home care agency liaison for the Elder Care Home Care Agency, as well as David Gilbert, the owner. Their licensed agency offers many unique services, and it's an honor to sit with them and learn more about the services that they offer.
Thank you for having us.
Thank you.
Yes. So good morning, Danielle and David. So nice to have you today. I wanted to talk to you a little bit about your agency. So maybe you could tell us, David, how long your agency has been in business.
Sure. So a little bit about us. We've been around for almost 30 years now. It was founded by my mother, who's a nurse and a social worker. She first started the business as a consultant, a geriatric consultant. She liked to call herself the daughter with knowledge. And about 15 years ago, we launched Elder Care Home Care, the licensed agency, due to the fact that she was having challenges finding caregivers in her own clientele. So we launched Elder Care Home Care about 15 years ago, and now we purely specialize in providing care for our clients with caregivers and nurses directly in the home.
That's wonderful. Yeah. Where are your locations?
We are currently in Westchester, Long Island, Manhattan, the 5 boroughs, and then also in Connecticut now.
That's
so our
fantastic.
offices are actually in Scarsdale, Westbury, Manhattan, and Stamford.
Yes.
That's fabulous. My goal is to have various licensed agencies come in to do the podcast for our listeners so they can make educated decisions as to who they want to use for services for their loved ones. So if you could tell us specifically, what does your agency offer that's unique to you?
Yeah, absolutely. I think it's interesting when you look at licensed home care agencies. The exciting part is we provide an array of services from simple companion care all the way up to complex nursing. And when I say simple companion care, when I always visualize it, I think about it as someone playing mahjong with their mother.
Right.
They're providing meals, hanging out with them, and supporting them in their day-to-day in a support function. Then there's the next level of home health aides, which is the hands-on care, the bathing, the dressing, medication management, things of that nature. And then you get up to the real clinical side. So that's as simple as a 1-hour visit with somebody might need a wound care. They have a wound and you need a nurse to come in twice a week. Or complex care where we have a nurse who's there 24 hours a day with a vent, a trach, or with just complex needs. So everything from simple companion care all the way up to that complex nursing is what we specialize in.
Which is so important because everybody's needs are so different. Right. So I know you, Danielle, for a long time, and I know how wonderful you are, that if every time I need help, I just call you and you call me back immediately and help. So tell me a little bit about how do I sign up for care and what is the intake process?
We try and make it as simple as possible. I'm always available. I do the intakes myself. I give them my cell number, my work cell number. I'll go through the process. I will meet them, the family members, the clients, for a consult, see what their needs are, see what hours, what days, what times, what care really works best for them. And then I bring it back to the office, and as a team, we decide what will be best fitting for the client and the family. If I'm not available, we have nurses, we have other social workers that can go out and do a consult as well, complimentary of Elder Care Home Care, and we try and make it as seamless as possible.
That's wonderful, and I know you do because I've used you so many times. So what insurances do you take?
So we are private pay, but we do take long-term care insurance.
Okay,
Yeah.
very, very good. Do you service any residents at assisted living programs? Because a
We
lot
do.
of people are going to ask, or nursing homes,
We do.
if
We
they
do.
need additional assistance. So maybe you could tell
Yeah.
us a little bit about that.
Yeah, well, sometimes in a nursing home or in an assisted living, that resident or client patient will need some one-on-one care. more companion care, someone to be there, make sure they're not getting out of bed at night if they're agitated, someone just to be there, like we said, doing mahjong or doing crossword puzzles, someone to stimulate their mind, safety precaution, make sure they're safe, they're not trying to get out of bed, God forbid, trips and falls, someone to get them their water, press the button if they do need an aid in the facility. So we do that one-on-one care as well,
Right.
to help implement
Exactly.
more
And
care.
I just add to that, what's critical in these facilities is sometimes they don't have the capabilities to provide that one-on-one care.
Right.
Someone might be a fall risk. So they generally have one caregiver per 8 residents.
Right.
If someone's falling 7 times a day, they don't have the capabilities, so you want to prevent an emergency happening. So that's when the facility or the family might call us for one-on-one. And then secondly, you have nursing homes. They're struggling these days. I think they do the best job they can, but they're understaffed, they're burnt out post-pandemic. So sometimes families really want a companion. They really want somebody to support and advocate for their mom for meals when they go to the bathroom. They might be sitting there ringing that call bell for 20 minutes before somebody comes.
Right.
So they want that advocate, and that's where we partner with these facilities, knowing how to work with them, how to provide the best quality care, and be complementary to them if necessary.
So that's important for our listeners to know about, because also sometimes somebody could be in an assisted living program, get additional help, and maybe prevent them from going into a nursing home. Or sometimes they're in a nursing home, they can't get all the care they need. So these are all options that are very
Right.
important for our listeners to know about.
And one thing to add to that is they also might have an incident or an accident, and they just need somebody at the assisted living for 2 weeks
Right.
to transition, right? You broke your arm. You want somebody for 2 weeks, and then once you recover, you have our services, and then you're back to your fighting self, and
Right.
you're back in the assisted living without any additional help. But we're always there to support them if they need that.
So we work closely with the assisted living facilities because they may have a resident that fell and had to go to rehab, and then they're coming back to the assisted living facility, and we help them acclimate being back home. Even like David said, if it's for a couple of weeks, it could be short term, and we help them keep their independence, gain their independence, and help them get stronger to be comfortable and safe.
Which is such an important point, because
Right.
our listeners need to know all the different options
Right.
that are available to them.
And there are so many.
Yeah. So one of the things that I think a lot of us get confused about is what is the difference between a home companion and a home health aide? So who wants to tell us about that?
I'm happy to. I think we
Okay.
kind of discussed it briefly
Right.
before, and that's the difference between a companion agency and a licensed home care agency is the level and quality of care that they can have is very different.
Right.
For the level of care for a companion, even when we provide a companion, like I said, it could be mahjong, it could be just providing cooking, light housekeeping, supporting them with conversations, motivating them to go on walks, but they cannot provide hands-on care,
Right.
which is a critical difference. And then the licensed agency and a home health aide. A home health aide is certified. They've had specific trainings that New York State specifically certifies them to allow them to put their hands onto the patient. And people say, what does that mean? I always say that means if you need to go to the bathroom and someone has to assist you, getting out of bed and turn in position or transition you out of the bed, getting you dressed in the morning, things of that nature. Managing your medication can be something
Right.
that you really want to be reliable and has to be overseen by a nurse. So things of that nature, you really have to differentiate the hands-on care aspect
Right.
and what that means. So we generally educate families to say, do you qualify for companion care or a home health
Right.
aide? And either one, we have the capabilities to providing both, but it's just a slight nuance.
Right.
Very
The-
good. Thank you.
The home health aide is more hands-on care, like David was saying. So people that do need showering assistance, help them in the shower, help toilet. Some of our patients are in adult diapers and they need to be changed. That would be a certified home health aide.
Very good. Thank you. We had talked about it before, and I think it's important for our listeners to know about the case management component of your
Right.
agency, to tell us a little bit about that, because that's kind of unique.
Yeah, no, that's a great question. I think Danielle is the perfect example of that. We have 2 layers of case management in our team. As a liaison into the community,
Right.
Danielle is a licensed social worker. She goes out into the field and can do that type of assessment, understand the clinical needs of the patient, create a customized care plan. So that level of care management, I always say, is the intake portion that we have nurses and social workers within the company and out in the field who do that initial assessment, understand the needs, and create a customized care plan.
Right.
But we go above and beyond by having probably the largest internal social work and case management department in a home care agency for private pay. And what that means is we provide the continuous oversight. that care management when a caregiver calls out sick. There's a challenging change in clinical needs. The family might not love that caregiver. We always say that this is such a personal decision that not everybody's the right fit. It's two different people. Maybe somebody's too quiet and shy and they want someone to motivate their father to get up and walk. So that type of care management is continuous. People think that it just stops when you place a caregiver in the home, but these are human beings. Every day is different. Every challenge is different. Things happen, and we got to roll with it. And that's where our nursing and social work team can really be that resource on a consistent basis to oversee the care. And that's the level of oversight that we provide when we say care management.
Which is wonderful, because I'm a social worker
Yes.
as well, and I really see the need. So
Right.
that's fantastic. So is there anything else you would like to add about your agency, or any important information you feel that the listeners would like to know about in conclusion?
I would just add, there's two aspects to families deciding on home care. The first aspect is always prices is in their mind, and I think people have to do what's financially capable and try and find the best agency or solution for themselves. The second piece is sometimes people look at it as a commodity. I just need to hire the service and then I'll be completed. And really, this is such a personal decision. People don't realize it's like choosing a doctor that you go in every year, or this person's in your home day in and day out. So I think finding the right fit is absolutely vital. And I think families don't realize sometimes when you're choosing the agency, you want an agency that specializes in finding fit and overseeing it continuously. Because as I said, people seem to think my father or my mother need X, and if you provide X, we're good. And that really doesn't happen. It becomes X, Y, and Z very quickly. Things change very fast. And again, people change. So making sure to find an agency that fits with your family's needs, as well as your parents' needs or the loved one's needs, because you're going to be interacting with this agency on a weekly basis probably, and the patients interacting with the caregiver 8 to 10 hours every day of their life.
Right.
So fit is something they should really emphasize when they're interviewing agencies, whether it's us or another one, and then interviewing the caregiver and understanding that they know who to select. Those are the two areas.
Right.
I think those are excellent points, because those caregivers become part of the family.
They do.
So you really want to pick very wisely.
Right.
Exactly.
And I know, working with all of you, that it's been a fabulous experience, and I'm sure my listeners will enjoy the
Thank you.
podcast today.
No.
So
And thank you. And
Yes,
you guys
thank
have been
you so much.
fantastic. And lastly, actually, I just want to add the resources such as yours and others in the field are
Right.
so fantastic. And people don't realize as home care agencies also know sometimes maybe we can't help these individuals, but we can introduce them to the people who can.
Right.
So services such as yours, introducing us to other individuals, you guys are so fantastic. So having you guys as resources is beyond helpful as well.
well, thank you. That's why we're trying to create that cool
Yes,
caregiver
absolutely.
toolbox, so everyone could have a plethora of services that are
Absolutely.
available to them. So thank you.
Yeah.
Thank you.
So I want to thank Danielle and David and our listeners for tuning into the podcast today. Please send us any comments about other programs and services you would like to know more about. And please email us at longislandeldercare@yahoo.com if you would like to be part of our email list for any future events. Until we meet again.